Hey everyone, Dr. Ryan Robinson you. In all seriousness, tonight I wanted to shift the gears and not talk so much about a topic or something along those lines, but talk something more important in my opinion, and that's how do you find the right doctor, how do you choose the right doctor, because there's so many practitioners out there and there's so much information out there. I really did research into things I thought were important, I thought I would want to look for if I was a patient looking into a doctor. And for whatever the reason may be, and this doesn't matter what kind of doctor it is or what kind of specialty, if it's a primary, if it's some kind of specialist, it doesn't matter. These are the core things that I would look for and that I would want to look for in, if I was in your shoes. So let's dive into this. I brought it down to 5 key traits or 5 key concepts that you want to look for, ask the practitioner about, look into, research. This is all the information that you want to know before you go see a doctor and before you choose that doctor. First one is take your time. So as a practitioner, I can tell you how important this is. If you're going in to see a doctor and they're just rushing through everything, maybe you think I'm rushing through this video, right? But if they're just rushing through everything, if they're rushing through the exam, the consultation, if they're just trying to get you in, get you out as quick as possible, what are their priorities? Is it the next patient? Is it they don't really care about you? Are they just looking for the paycheck? Like, what are their priorities? If a doctor's going to do a good job, he's going to sit down with you or she's going to sit down with you, they're going to go over everything. They're going to go over the health records with you. They want to know exactly what's going on. They want to ask key questions. And then they want to go do a thorough exam. They want to, depending on what your problem is, they want to look into it and they want to develop a diagnosis. They don't want to just rush into that part, because when you're gathering all those facts in the beginning, that's the most important part. And if you just rush through it, then what's the point? So find somebody who will take the time, who goes the extra mile and put in the effort, because they have their best interests in mind, that they're not just trying to collect a paycheck. They're actually trying to do good by you. Their interest is in you getting better. Okay, so I'll start with that. That's pretty self-explanatory. Communication, I think, is another big one. Now, this may differ for people. This is my opinion, but I know there's a ton of people who think like I do out there, and sometimes you don't want that doc. They may be the smartest in their class, but they have poor bedside manner. They can't talk to you, explain things. It's all over your head, and you don't even know what's going on. We've all had those kinds of experiences before. That's not necessarily the person you want to see. Now, there's a time and a place for that. If you have some kind of life-threatening illness or condition going on, I don't think you care. If they're the best, you want them. But in general, you want somebody who will be able to talk to you, communicate what's going on. And, I take pride in that. If anything, I go above and beyond, and I do too much of it. I over-explain, I try to over-educate, because I feel like it's important. This is a two-way street when a patient comes in to see me. It's not me telling you this is how it's going to be, or using a bunch of fancy medical terms that are way over your head. It's about getting down to your level, explaining things, and if anything, explaining too much. You need to know what's going on, and I want to educate you so that you can make the best decision possible. This isn't a one-way road. I'm not telling you what to do. That's how they did it 50 years ago. It's not how people do it anymore. You want to be educated. You want to know what your options are, and then from there, you want to make an educated decision. That's what I try to do here, and it all starts with that communication. And, taking your time stems into that as well. I take my time to get all the facts, and then I deliver all the facts to you so that we can make a decision. You'll kind of see as we go through this that these tend to flow together as well. Up to date on research. Once again, this may differ depending on the person, but typically people want somebody who is staying up to date on stuff. And what I mean by this may differ is, my opinion, once again, and I know this is the opinion of a lot of people as well, is typically you want to go to somebody who's younger because they're fresh out of school or their education. And I'm not just saying that because I'm younger, but they tend to be more up to date on what's out there, what's current, what's going on. They're hungry, they're looking at research, they're doing stuff. Where if you go and see somebody who's older, typically they're set in their ways. Now, yes, they may have experience, but they're set in their ways and they're not up to date on what's going on or what's new out there. So, if you want to play it safe, find somebody who's middle-aged. They have some experience behind them, and they're still usually up to date. But a good question to ask, and I kind of touch on it down here, but a good question to ask is, what are you doing for continuing education? How are you learning? How are you continuing to strive? Can you show me any certificates, any advanced degrees, anything like that? I have a bunch hanging up in my office as far as certificates and advanced degrees. Completing the functional medicine, and in a couple of years the plan is to go on to my diplomat in nutrition. I'm doing all this continuing education, and I get updates via email on new research coming out on search terms. I'm constantly looking. You want somebody who's constantly doing that. I'm constantly doing these videos because I'm constantly staying up to date on the information and then trying to give it back to you. You want to find a doctor who's doing something similar to that. You don't want somebody who's just coming in, once again, collecting the paycheck and going home. That's not the person you're going to trust your health with. It's up to you, but if it was to me, I want somebody who's staying up to date on stuff. No judgment and professional. I kind of group these together because I think it falls within the same lines. You don't want a doc who's being unprofessional, cracking jokes that may be offensive, or coming on to you as far as flirtatious, or any other kind of unwanted actions, basically. And then judgment. So these two tie together because say they start to cross the line as a practitioner and they make you feel uncomfortable. How likely are you to bring up certain conditions that you may be having? Maybe you have gas or something, or you're having issues of sex, whatever it may be. If that person is not professional enough, if they've already kind of crossed the line with you, how is that relationship going to go? I mean, how willing are you to bring up things that are going on with you, and then how are you going to take that person seriously too? If they're not professional and they're not working with you, and it's more of a friendship and they're goofy with you or whatever it may be, do you really trust what's coming out of their mouth? Like, are they giving you the most accurate information? You got to kind of weigh that, but there's a fine line. You don't want somebody who's a stiff either, right? But you want somebody who has some kind of personality, but at the same time they're professional, they don't judge you, they keep your best interest in mind. And then the last one down here I wanted to talk about is providing quality care. Typically that is hard to figure out ahead of time. The best way of figuring out ahead of time is looking up testimonials, look up reviews on Google and other platforms, ask friends, family, other medical professionals that you may see, hey, have you heard about this person, or who do you recommend, those kinds of things. Because typically, especially medical professionals like myself, we are creating this network, and it's all about who we know, like, and trust. And if we know or like some provider, it probably comes with good merit. We probably vented them out, questioned them, know that they're a good practitioner. So we're always a good source. If you're going to see your dentist, your primary care provider, whoever it may be, ask them for their opinion. They probably can point you in the right direction at least. But friends and family, you always trust their opinions. They're going to look out for you as well. But otherwise, you look for subtle things. So like these other things that I mentioned up above, they're good indicators that if they're doing all these different things, that they're going to provide good quality care. If they're rushing through things, quality care is probably not going to be there. If they're not communicating with you, quality care may be there, and they may provide excellent service. But if they're not communicating it to you, part of the equation here is you understanding the quality of care you're getting. And if they're not communicating it, how do you know? Up to date on research. If they're not staying up to date on stuff, then they're probably not going to give you the best care. And then no judgment professional. If they're goofing around or crossing that line, the care is probably not going to be the best either. It's kind of a joke when they come in here. You want somebody who's professional. So all four of these kind of lead into this last one. But the other thing I'll look for is somebody who goes the extra mile. Like I said, when you come in and see, for instance, somebody like me, I'm going to take all the time in the world to go over things with you. And then I do things differently. It sets me apart. I'm looking at the feet. I'm looking at leg length. I'm not just looking at a spine as a chiropractor. In the functional medicine, I'm looking at what are your other conditions. Do they all play a role? Because the systems in your body, they all work together. So if you're having bloating or other issues, is it related to the back? Is it related to some other system in your body? How is all this working? And I look to try to figure out everything. I'm not just going through the emotions, or I'm not just collecting a check. I'm looking to provide the best quality of care. So these are kind of the 5 things that I would look for if I was a patient, if I was in your shoes and I was looking for a practitioner. Once again, it doesn't matter who it is, whether it's a primary care physician or your family doctor, or if it's some kind of specialist, cardiologist, chiropractor. It really doesn't matter. You want somebody matching these 5 different traits as you may. You want somebody who's going to go the extra mile for you. So those are my recommendations as far as looking for a doctor.